I think one step is to appreciate that there are different causes of tinnitus and likely different mechanisms. And so it's unlikely that one pill is going to help everybody. And so the important message there is that it's important to try and make distinctions between the different patients and subgroups of patients. And we can do that. A lot of my research in psychoacoustics noted that, for example, for some people, you play a noise, you cover up their tinnitus, you turn the noise off after 10 seconds, and the tinnitus is gone. But for other people, it makes no change at all with their tinnitus. I think as a first step, connecting with somebody to realize that they're not alone, to realize they're not making it up, to realize that the reactions that they're having are reasonable is an important first step.
Today's guest on the Tinnitus Relief podcast is Dr. Richard Tyler. He is a PhD scientist and esteemed expert in tinnitus research and treatment. With decades of experience, he has made significant contributions to understanding and managing tinnitus, helping countless individuals improve their quality of life. Dr. Tyler's work has been recognized and celebrated within the audiology community, earning him numerous awards and accolades. Today with us, Dr. Tyler will discuss the latest advancements in tinnitus treatment, share his insights from his extensive career to help you reduce and manage your own tinnitus, and explain practical strategies that you can start implementing today. Dr. Tyler, thank you for joining us. One of your core contributions to the tinnitus community has been tinnitus activities treatment, which is a protocol that you and colleagues developed to help guide patients towards reduced tinnitus, towards habituation of the perception of tinnitus. Can you tell us a bit about why you created that? What was the original problem or the circumstance for why your team created tinnitus activities treatment?
Well, initially, and of course I started this work with my first job in the United Kingdom for the Institute of Hearing Research, and there were just people beginning to get interested in tinnitus at that point worldwide, and not a lot of options for treatments, and not a lot known. And there were, a lot of people trying different electrical activities and different stimulation sites, but not connecting to the patient and not counseling. So there were various people starting up different counseling strategies, but I think I didn't appreciate them. I didn't think they connected as well to the patient as they needed to, and I didn't think they accepted the individual differences that are available. So when we all have challenges, we all react in different ways, and tinnitus can affect people's lives in different ways. So I think the first step in connecting with the patient and understanding what kind of counseling is needed is to see where the individual patient is at and what kind of problems they're experiencing with their tinnitus. So they're all different, so we have to understand where the patient is at as a first step. And that led us to develop our tinnitus activities treatment.
What's the core teaching with the activities treatment?
Well, so the primary starting point is to appreciate that there are 4 different areas that can be affected by tinnitus. Everybody's different, but potentially they can be affected in their thoughts and emotions. They can be really upset with this. This is terrible. Why is it happening to me? They can have trouble getting to sleep at night. So they go to bed into a quiet room and there's a sound that they have no control over in their head, and that's a problem for sleeping. Also, concentration. So when people are trying to read or focus on a hobby or do something at work, they can be distracted by their tinnitus. So that can be very disruptive. And then the other area is hearing. So when you're having this sound in the background, that can interfere and distract and mask some of the speech you're trying to listen to. So tinnitus can also have an impact on your hearing ability. So that was the basis for our tinnitus activities treatment, was to determine where the patient is at, determine what problems that they're having, and then design this individual picture-based counseling strategy to go through for the individual needs in the 4 strategies that depending upon which ones they're affecting their lives.
If this information with Dr. Tyler intrigues you, I'd recommend that you speak with an expert audiologist for a telehealth consultation where you can ask all the questions you have and get a personalized treatment plan specifically for you and what you're going through. If that's of interest, check right here where you can book a free call with a Treble Health specialist, and our team will be able to provide next steps for how we could potentially help you with your tinnitus. Let's get back to the podcast. And what did you guys find in terms of the benefits this gave to your clients, to your patients, when they are struggling with sleep, when they are trying to deal with the tsunami of emotions and negative thoughts that come up with tinnitus, when they're managing the fight or flight response, when they might have trouble hearing as well? What kind of benefits did you see with this method?
Yeah, well, I think it helps a lot of people. I think as a first step, connecting with somebody to realize that they're not alone, to realize they're not making it up, to realize that the reactions that they're having are reasonable is an important first step. And then the picture-based counseling in the individual 4 different categories helps people move forward and learn things that can reduce the prominence of their tinnitus, that can help them sleep at night, appropriate for everybody, including the use of sound therapy in the bedroom. But the different areas, including hearing and concentrating and being upset by tinnitus, these things need to be dealt with because they can be very disruptive for your life. So having counseling sessions, we would often start off with a counseling session and go over the 4 areas, find out the most difficult one, and then show them our pictures and our strategies for dealing with thoughts and emotions. They have homework to do. They go home for a couple of weeks. They come back, we go over their homework, and then we go on to the next area. Okay, this is important for sleep. We go over our slides for our sleep help and talk about sleep and what problems they're having, some strategies that they can use. They go home with this homework. They have things they can keep track of, and then they come back in 2 weeks. So we do that with all 4 of the different subcategories, depending upon the individual differences. So they come in for the clinical visit. We go over what the program involves. They go home with some assignments. They come back in a couple of weeks, and we go through their homework, and then we start on the next strategy. And of course, this can be done remotely these days, and also we sometimes ask them to bring their partner if that's part of the issue, if they have one. So I should also say that sometimes we actually start off with a group session. So with the group session, and we approximately do this once a month, with a group session, we would have people come and say that if you want to, you can bring your partner, and we're going to do this. And we sit around a table, and then I give a presentation about the problems and about the possibilities of helping these patients. And one of the nice things about this is that the individuals with tinnitus see that they're not alone, that there are other people suffering from this. They can see that they're having similar problems to what they're having, and maybe it's worse, maybe it's better, but they're experiencing similar problems. It's also helpful for the spouse to see that other people are going through this as well. So that initial group session is a really important starting point, if that's a possibility, to show people that the responses they're having are reasonable, that other people are dealing with this, and we go through this as a first step, and then individual therapy follows.
I know that's so important to have a protocol, have a system to follow. There's some different models for tinnitus, and whenever someone works with an expert audiologist like my team or like the doctors at the University of Iowa, they know that based on the audiologist guidance, they'll be brought through a protocol that has a high likelihood of success. How would you define success in terms of tinnitus treatment? In my eyes, the average person comes to us with, say, a 6 or a 7 out of 10 intensity tinnitus, and they're aware of it, say 80% of their waking hours. How do you define success? How do you set expectations for what does successful treatment of tinnitus look like?
Well, in our model of tinnitus, in our psychological model of tinnitus, we make the distinction between the tinnitus and the reactions to the tinnitus. So there are some things that we can do with sound therapy that sometimes actually can change the prominence of the tinnitus and reduce that. But the counseling with tinnitus activities treatment moves forward with the reactions to tinnitus. And we have developed a um, questionnaire, the Tinnitus Primary Functions Questionnaire, which we give to people at the beginning to see where they're having problems. And we can offer that at the end as well to show them how they benefited from the treatment in different areas. So that's the way that we quantify this.
And let's say that a patient's asking you, what is it going to look like if I'm better? How do you describe the potential benefits, whether that's, the reduction of the sound volume or the reduction of the awareness of the sound or anything similar to that? What would you set the expectations there for in terms of what's the real world benefit of a successful treatment?
Right. So again, we have to make the distinction between the tinnitus and the reactions to the tinnitus. So sometimes in the sound therapy we use, the actual tinnitus itself can be reduced, but that doesn't happen all the time. And so I think it's really important to say that we're here to help you. You're not alone. Um, we might not be able to change the tinnitus itself, but you can change your reactions to the tinnitus, and we can help you change those reactions. Everybody in life has challenges. There's always stuff going on, but there are things you can do to improve your sleep. There are things you can do to improve your emotional reaction to this, and part of that is realizing you're not alone and that there are some other people that have this, and that there are some activities you can do to not notice your tinnitus, for example, as often during the day.
Absolutely. Absolutely. Sometimes the volume of tinnitus does get better after a tinnitus treatment, but in other times the perceived volume stays about the same, but someone's life can change dramatically. That part of it is hard for the average person to wrap their head around. I think it's a little complex, but that is what we're describing is the power of habituation or reduction of the awareness of the sound. If that starts at 80% of waking hours, the reaction is high, and then the awareness is say 20% of time, the reaction is low. That can be a majorly successful treatment despite the sound volume not changing. So that's an important piece, and I hope that folks who are listening here are learning about the nuances of this. I do want to ask you, Dr. Tyler, in terms of tinnitus research here in 2024, 2025, and beyond, what is your take on the current update of research bringing us forward? What are you excited about in terms of tinnitus, hyperacusis, which is sound sensitivity, other related conditions?
Well, I think one good thing is that there are a lot more people interested in helping tinnitus patients and a lot more people in pursuing research activities. There's been lots of things, and I've worked with several companies and continue to try and be helpful for groups interested in coming up with treatments. I think one step is to appreciate that there are different causes of tinnitus and likely different mechanisms. And so it's unlikely that one pill is going to help everybody. And so the important message there is that it's important to try and make distinctions between the different patients and subgroups of patients. And we can do that. A lot of my research in psychoacoustics noted that, for example, for some people, you play a noise, you cover up their tinnitus, you turn the noise off after 10 seconds, and the tinnitus is gone. But for other people, it makes no change at all with their tinnitus. Some people hear a ringing sound, some people hear a rushing sound, some people hear it in their head, some people hear it in their ears. There are many different ways of measuring tinnitus um, in terms of pure tone masking, in terms of post-masking effects I described. Um, and I think it's important in terms of moving forward to appreciate these subgroups because there are likely different mechanisms in the ear and in the brain that are causing this. People hear it differently, they localize it differently, and it will be important to find something that focuses on a subgroup and fixes that subgroup as opposed to one pill fixing everybody. So it's a complicated process, but we have to appreciate that we're calling this tinnitus as one single thing. But the manifestation in the brain and in the ears is different in different people. So that's an important step here.
Totally agree. An ENT physician from Germany had spoken with me on our podcast, and we had discussed his research. And from his opinion, and generally what I'm seeing as well, is that a vast majority of cases fall into one of three subtypes or root causes, being cochlear based, or somatosensory based, or central or stress induced. And that's been very helpful for how we communicate with our patients at Treble Health. Our doctors communicating that to our patients of, hey, here's the three most common subtypes that we see in this profession. What factors are at play for you? Great, let's identify those. Let's create a treatment plan that is addressing the cause of the condition, because sometimes tinnitus as a general term is more of a symptom. And when we can get to the root cause, it opens up the effectiveness of treatment. Do you have any other comments there on root causes, different subtypes, and targeted treatments?
Right. So I think it's important to make the distinction between a middle ear tinnitus and a sensory neural tinnitus. So the middle ear tinnitus, that's how I define it, is something going on in the middle ear behind your eardrum, usually a muscle twitching, for example, or a blood vessel that's pulsing that's heard by the sensory neural system. The other type that I like to refer to as a sensory neural tinnitus. So it's some hyperactivity going on, beginning either in the cochlea or in the temporal lobe or somewhere else in the brain. So those are important things. Another way of categorizing tinnitus, you mentioned somatosensory tinnitus, also very interesting and maybe a valid subtype. That is, for some people you can change the tinnitus by touch, by pressure, different in different people. So although I think that's important in terms of a simple way, I'm going to say, of distinguishing different subtypes, I think, as I mentioned before, some of the actual measurement ways, are important, leading to different sensory neural differences among tinnitus patients. So for some people, you can mask their tinnitus. For some people, you can't with an external sound. So there's something going on differently in the brain in those two subtypes of tinnitus patients. So I think as we get more specific in terms of brain stimulation and electrical stimulation in the auditory system and the response to things like the vagal nerve and pills, it'll be important to appreciate that there are different subtypes and we're likely to help some patients, but not everybody.
Absolutely. Guys, if you're listening and this has been helpful so far or interesting, I want you to comment below here on YouTube, helpful. Dr. Tyler, let's now pivot and talk about research in the tinnitus world. You're an expert researcher. In your opinion, what should the average consumer look out for when they're reviewing a new research article for tinnitus? What is considered a good research quality or a quality standard that we can learn from you?
Well, that's a difficult question to share with patients who are not used to doing research and not used to experimental designs and not used to measurements.
Sometimes those are the exact patients that are online looking, seeking, they find something, they read a few sentences, and it creates a story in their mind.
Yeah. And as I often say to my colleagues, there used to be 3 audiology journals. Now there are 300. So the field is quite complicated in terms of moving forward and good research designs. I think that it's important in terms of the research to, again, appreciate that there are different types of tinnitus, likely different mechanisms. And so it's important to see the individual results, not just some group averages. it's important to realize that there should be an appropriate control condition that's described, where that the patients treated didn't know what group they were being assigned to. And of course, also important to keep in mind um, what's the motivation behind the people doing the research and how that might have influenced the results. If it's a company, then were they doing it on their own? Did they have some unbiased help doing this? So it's complicated. Um, and again, I think that there is a lot of interest in helping tinnitus patients, and I'm not trying to be negative. There are some good studies going on and some good potential, um, and I think that's a good thing. But there's a lot more research needed, specifically looking at subtypes with appropriate measurement techniques. But we're moving in the right direction.
Absolutely. Love to hear that. Would you be able to share with us what is the most promising research out of the University of Iowa from your team that you're excited about coming down the pipeline here, or recent published research?
Well, I guess I can say in terms of, I can just, in broadly speaking, in terms of research designs, I'm quite pleased that our tinnitus primary function questionnaire, which again focuses on thoughts and emotions, hearing, sleep, and concentration, is important for measuring the benefit in a treatment trial. And so I think that I'm pleased to see that that is being translated worldwide and used more frequently. And again, if somebody's not bothered by sleep, then that subscale can be not used in the evaluation of the effectiveness of that treatment. The other thing that's important for research um, is that there's a lot of people worldwide using quality of life scales. There's probably 4 or 5 widely used quality of life scales. And I was quite shocked when I looked at these carefully a few years ago, and very few of them um, even consider the importance of communication and hearing and socializing with people. So we developed a new quality of life scale, which was published a couple of years ago, that was referred to as the meaning of life, to try and capture people's attention. But it emphasizes different ways of interacting with people, and including hearing and what happens if you can't sleep, and things that are relevant for hearing loss and for tinnitus. And we tested this on many patients with tinnitus and on many patients with cochlear implant. And when it was published, the editor of the journal wrote a nice one-page acknowledgement at the beginning of the journal saying what an important step this was.
I love that. Well, thank you for that contribution. And University of Iowa has always been one of the leading tinnitus research institutions. I heard that there was some research into sound sensitivity, which is often occurring alongside tinnitus. This is medically referred to as hyperacusis. Would you be able to share what you guys are working on in that regard?
Yes, well, I'm working with a colleague, Anne Perot, at Augustana College, and we have an online study going on now that she's leading. And this uses both some counseling and our hyperacusis activities treatment, and also uses background sound. So different in different people, but in our hyperacusis activities treatment, we, some people just have argued, Jack Vernon, for example, that just listened to noise in the background for half an hour every day, and then over several weeks and several months, turn the noise up gradually, gradually. What we developed in our hyperacusis activities treatment is copying sounds, because almost everybody with hyperacusis can report on 2 or 3 or 4 different sounds that are really bothersome to them. So what we developed was a sound therapy for hyperacusis, where people can record those sounds or make up some sounds online that are similar to what they're bothered by, and then sit down and relax, put your feet up, listen to those sounds at a low level that you're comfortable with. And then gradually over time, listen to it for longer periods, listen to it at higher levels, move from your living room with your feet up to the actual environment. So an example that I often give is a lot of people with hyperacusis are bothered by dishes in the kitchen. And so again, you can listen to those sounds carefully at a low level with you relaxed in the living room, and then eventually move to the kitchen. And you take the dishes and you softly hit the fork to a cup, softly, gradually. And then gradually, over several days, perhaps over several weeks, depending upon the individual needs, do more of that for longer periods of time and at higher intensities. And then let somebody else do it, make the noise for you, so you're not controlling it yourself. Again, starting off at a low level. So that gradual habituation process is something we developed in our hyperacusis activities treatment. So have to be careful, different in different people and different needs and different challenges. But that's one example of how we can move forward and try and work with the individual to deal with their hyperacusis.
I think that's really important. I've seen success with that with our clientele at Treble Health, that desensitization protocol for hyperacusis and sound sensitivity, introducing specific sounds in a controlled environment where that emotional anxiety or resistance or fear around the sound is as controlled as possible because it's in the living room, as you suggested. I'm pressing play. I'm controlling this, and then working its way back over time. Completely get that. Well, that's really exciting. As we're wrapping up here, Dr. Tyler, how can people follow your work and support what you're doing out of Iowa?
University of Iowa website, both for otolaryngology and for communication sciences and disorders, has opportunities to connect with us and ask comments and provide suggestions for how we can improve or things that you've found beneficial or not beneficial. We love to hear ideas. Patients often have good ideas on how to move forward. So we always look forward to understanding where the patients are at and what they've tried that's been successful.
Amazing. Thank you so much, Dr. Tyler. I look forward to speaking with you soon. And you'll definitely always be in my eyes as one of the leading tinnitus researchers of our time. So thank you so much. Thanks for watching today's podcast with Dr. Rich Tyler. If you'd like to check out Treble Health, click the link on the screen right now, or you can book a call and speak with a specialist from our team. Guys, this is Dr. Ben Thompson. You're watching the Tinnitus Relief Podcast. If you need help, reach out to us. And thank you so much for being here.